This is my second video dedicated to the Arthritis Awareness week in October. It is also dedicated to the launch of an app for our clinic, for the back pain center. The app designed to connect chiropractor and the practitioner, sports therapist and the practitioner, physiotherapist and the practitioner. They all work at our clinic and they all at your service, not only to get you in for a treatment, but to give you advice through the app, through the email, through the talk, through the connection of any sort. So the app is dedicated to that. And this video I want to dedicate to this arthritic event, arthritic prevention event in October, by doing a little bit of tipping and helping on prevention of arthritis. Some arthritis, some types of arthritis you cannot prevent because they happen from inflammation in the body caused by immunity, autoimmunity, or caused by some inflammation from overreaction of the body to infection or to a disease like psoriasis. Or so basically there are some inflammatory arthritis, types of arthritis, which is very hard to predict, only through a very good health, balanced diet and other things. Other arthritis, which is actually more common, like degenerative arthritis, are very easy preventable, okay? And if you don't start early and the arthritis gets hold of you and it progresses, they are easily stoppable and reducible. I mean, you can reduce the symptoms and you can stop the progression and feel good and continue doing things, right? So this video is about prevention of this degenerative arthritis, or what we call it, wear and tear arthritis, right? So first of all, when doctor tells you, oh, you got arthritis, it can be for your knees, it can be for your hips, it can be for your shoulders, it can be for your spine. It means absolutely nothing unless you're fully assessed and examined by the doctor, by hand, by reflex hammer, by the sets of chiropractic, orthopedic and neurologic testing. Or of course, if doctor is not chiropractor, they will only do orthopedic and neurologic testing. But unless they done all the tests and they assessed fully your range of motion, your flexibility, your alignment, your ability to do certain things, your diet, many things, they can't really tell you that you have arthritis, go away, right? They have to give you hope. They have to tell you, look, there is some wear and tear in your spine, or there is some wear and tear in your hips, but it's only at this particular stage where you can do so many things. You can do this, you can do that, you can, I don't know, simple, like for the hip, you can lose weight, you can improve your foot wear, you can improve your alignment of the pelvis, your back, your spine, you can improve your innervation from the spine to the hip, you can relax your muscles around the hip, which is your glutes, your muscles of the leg, and you can walk on that hip for many more years, right? So don't just go with, oh, I have arthritis and I need the hip replacement. Just look, have a full assessment, have a full check, have an X-ray, have an MRI, whatever is advised by your practitioner, and then judge on it. Same for the spine. If you have a problem in the spine and you just say, oh, I have arthritis, I have to take painkillers. Some people do take painkillers for years, and they damage their stomach and they have lots of side effects, and then they take other tablets for their stomach which cause their digestion to go wrong, and they do not absorb nutrients anymore because of that properly, so they don't repair properly, and it's like a chain of events. Just don't take this, just don't, just look for more answers, look for more advice. And the advice is very simple. Your joints are made for movement. every joint in the spine has to go through the full range of motion of these joints every day. So the ligaments and tendons and all the muscles around the joints continue doing their job properly. And this is the best prevention method. And that's what chiropractic is about. That's what we're trying to install in people, right? Yes, you are sitting like that all day with your computer, but why don't you get up and stretch every half an hour, and do all these little movements for your shoulders, back and neck, and make sure they're still working, because you feed them. I often say that it's like a baby. Baby is crying, they're hungry, or they need the change, or they need to pee, poo, or they need a hug or cuddle. Like, give it to them, and they're quiet again. They cry, you feed, they're quiet. So feed your joints, feed your ligaments, feed your tendons, feed your muscles, give them love, give them a hug, and they will work. Even they are at the level of wear and tear, even you've been told they have arthritis and they're worn away, give them love, give them what they deserve, flexibility, alignment, lubrication, nourishment, give them food, give them hydration, and they will be happy. I cover that in other videos about inflammation, about the range of motion, about the chiropractic adjustment, about these basic stretches. And they're all very simple, and most of them are free. And they prevent the arthritis. And if you do have arthritis already, they prevent the progression. I have arthritis in many of my joints, but I don't hurt. And it doesn't progress. Because when I got this arthritis, I also learned how to fight it, how to see it, how to meet the requirements, the needs of my body for the arthritis not to progress. And it's not progressing anymore, touch the wood, right? So this is advice for you. And you can always ask your chiropractor, your osteopath, your physiotherapist, your sports therapist, what do I do to stop this joint stiffening up and rubbing hard and wearing away? What do I do here? What do I do there? And do it. And most of the times it's easy. You know? Yoga, Pilates, swimming, stretching, walking, right? Sitting and standing properly, which covered in other videos, right? For you. Do that. And arthritis will be gone. And you have a good life. And you can do things you like doing, when you like, as much as you like. Simple. Thank you. I'll see you in the next video. Download the app.